Good day.
Good day.
How are you?
It's a good day today.
Yeah. Let me introduce myself first. I'm Ibrahim Ajame. I'm also a member, right to see. Today we visited your zone, Old JESHWANG Health Center. If you can kindly introduce yourself to the general public.
Very well, thank you very much. My name is Charno Yade, the General Manager of Adinli Old JESHWANG Health Center. Old JESHWANG Health Center is located in Old JESHWANG Community, KMC, Serakunda. The facility is a community health center that is geared towards providing quality medical services for the affordable quality medical services for the community of Old JESHWANG and its catchment area. We are excited to have site saves right to see here to come and grace our community, giving a very noble gesture to the community in the time that it is just needed, because people are definitely having a different type of issues with their eyesight and such related problems, and some of them cannot afford to go to hospitals and pay some bills. So it is nice of this group of people to come and give this kind of gesture to the community, which definitely we are very well excited and very happy, and we want to just thank them for their noble gesture. Yeah.
Okay. How many patients you are expecting for this clinic?
Yeah, approximately we have already registered 200 patients.
Already?
Yes, on our list. People are still coming in, and there were also carryovers from other activities that the program have done. So at the end of the event, we will know the final number, but for now we can know 200 plus people. Yeah.
But this is the first time they have been coming here, or this relation was between you and them for?
Yeah, this is the first time we had a link with them through one of their members, Ablaiba, a colleague of mine that works in Edward Francis Small Teaching Hospital. I've been following up with him for him to host this type of events in the clinic, because as I said, it's a community facility. So we always want our communities to have some of this access. And as you know, Gambia is, should I say, a country that has, that the medical sector is not very well advanced, that can help people, and sometimes it can be very expensive for some people. So that's why we want our community to have this. So during this discussion with one of the members, Ablaiba, one of these the program was scheduled for this 9th of November for Old JESHWANG for the first time, which we will always want to happen on a more frequent basis, if depending on availability of the people, and also most importantly for it to be financed or sponsored, because these type of events are very, very important. The facility will have to, as a community facility that is non-profit making, will have to buy medication, rent chairs and tents, and I'm sure also these guys who are coming in here have finance on their own to come here, transportation, or so on and so forth. So it will be very important if anyone out there seeing this to be able to sponsor this type of events. It will be very, very important for the community and the Gambian people.
Suppose this one they cannot attend all of them. What do you do next? Will you invite them again? Or?
Yeah, our hope is that when we finish the whole program, we will write how to call it, a summary, a kind of report to show the progress that we have made and what is given. But of course, obviously, I've already started talking to them about another event, because some other people still, after registering 200 people, we started rejecting people. So there are more people who need the services. So of course, we want another event. If there is anyone out there looking to help us support these noble events, it will be very, very good.
So it's a community-based hospital, health center.
Yes.
So meaning that the community is managing the health center.
Yes.
So how long you have been here?
I have been here for almost, I've been here since 2011. That's like almost 10 years plus. I've been in the facility. I become the general manager in 2021. Since then, we're trying to develop it and improve the facility. And these are one of the events we normally do for our community. It's like some of the community outreach, going outside to give people free services and free medication. And this is one of the events also with the right to see.
Okay, hence you are the general manager. I know you have been facing some kind of difficulties here. Managing is not easy, especially when it comes to medicine and other things like that. It's very expensive. Whoever contributed to the health sector, you make no losses. So what do you say to the general public to join hands and have this health center? Very important because it's already based in community, and in communities here, as we know, most of them are not
financially
strong.
Yeah. Well, definitely speaking, the facility needs all of the support that it gets. As you know, medical services are not cheap. When you're talking about operations like having your staff, payment of staff, doctors, nurses, buying of medications, as you can see, light is gone. We have to buy a lot of electrical fuel and all of those things. And the operational aspect of it, it's very difficult to manage. It will be really good if we can have sponsors who will come in and help in all of these areas, because at the end of the day, it's going back to the public. Of course, the ministry and the government are trying to do whatever they can. But as we know, health is difficult to finance. So it will be important that if you have other partners outside who can help, it will be very, very good.
Okay, finally, then what will be your closing remarks?
Just, very excited and thank Allah subhanahu wa ta'ala for the this kind of event. Actually, we are here on voluntary basis, giving people services. That's very, very a good noble gesture for the whole community and the Gambia at large. So I want to encourage myself and encourage everybody else to, especially to thank the Right to See movement for their gesture, coming to Old JESHWANG clinic to, give services to people. But also encourage myself and encourage everybody else to kind of put in their money or put in their services or efforts into these kind of events. Then Gambia will be a better place. Thank you very much.
Thank you very much. You are a staff?
Yeah, I am a staff. Yeah, I am a staff here. I am Hadina. I am the accountant. Yeah.
How do you see the clinic?
The clinic, it's a very good clinic. It's a health center, but we offer so many services like other hospitals are offering. We have service like gynae service, we have laboratory, and our lab is well equipped, and we do many services or tests. So it's a clinic that it's very, very, very good, and it's not well known, but now I can say since I joined the clinic, I can say it has improved in so many things. So that is all I have to say with the clinic. We have doctors, we have nurses, we have all the people that are important that are in the health sector. We have them here, and we make sure that we give quality services.
So I can see that today Right to See comes to your area.
Yeah.
So how will you feel towards that operation going on now?
Yeah, we feel happy to have them here because since they said that they will be coming, we made sure we had an open registration. We created a flyer and people we are calling here and there to book an appointment. But if you can see the crowd, you can see that even those that we are not registered are here. because they believe that they have the right to see. And since it's something that is free, and we know that it's a community health center that needs to offer these services, so we are grateful. When they said they were coming, we were happy to host them here. So that is all I have to say with that. We thank them for coming, because if you can see, they come with their team, they come with all the necessary things they need, and we are helping them as the staff. We are working with them to make this a successful program.
Okay, you've been the accountant of this noble health center. You know finance, how difficult it is, and then all these classes and things like that, the management teams, arrangements of them need finance. And then the donors are doing their work, and we have some governments who are fit enough to sponsor. What would be your advice towards that people to help hold the health center and this noble NGO called Right to See?
Yeah. As a finance person, I'll be very happy to ask for, like, we are a health center being funded by the patients we see, and it's difficult because everything is expensive, you see. So when these people say that they were coming, it was not part of our budget, but we need to create what we call an emergency budget to make sure that we run this program efficiently and effectively. We needed chairs, we needed tents, and you understand. So if we have people that will come forward in helping us or in funding things like that, because if you when one of them were giving a speech, he said that because of certain things they needed, they could not do it on their own. You understand? Which means like the things like chairs and tents, so they cannot do it. So they had to go to hospitals to tell them that we have this program that we are doing for free. So if you can come, so that is how we try to manage what the finances, the small finances we had, to make sure they come, and we give them all the necessary things they need. We make sure they give us a list of drugs they needed, so we need to buy those drugs to make sure that we give back to the community. So I am urging every one of you, if you know that you are a donor, and if you know that you want to help us, we are here, we are seeking for help, because we cannot do it all on our own. We depend on our patients, and if the season is down, it's difficult to see patients. And if you are funding yourself, you need to have strategies in places to be able to pay your salaries at the end of the month. So if we have donors to come and donate us, or because if you can see, even our ambulances here, so sometimes it goes down, and we have to finance it, or we have to do some maintenance. So it's always difficult, but we try to manage and give services. Even though, if you can see, we are a clinic that you know that our consultation fee, it's at 25 still, looking at how expensive things are. But we make sure that since it's a community health center, we have this community commitment towards us to make sure that we don't charge extra, to make sure that everybody is seen according to their budget. So I am urging every one of you, as a finance personnel, it's really difficult. Things are expensive, medications are expensive. We don't have free medication. We buy our medications, we buy our lab consumables, we buy our hospital consumables. We bought everything by ourselves. So we are urging every one of you, if you know that you can help, it's a community health center. We are open, you can come, or we can reach out, because we have been reaching out to people. But we will not relent. We will still reach out to donors. If anyone wants to help, we are here.
Okay, like Right to See also, as you are saying, is functional like how you were explaining yourself about the health center. And Right to See, the sources is from German.
Yeah.
That's a German brother, it's a Gambian brother who is living in German. He's one towards all these things. Now, what will be your tip to advise our fellow governments who are in position to make support with, so that this clinic will keep going around the country?
Yes.
Because all of these staff, we are seeing them, they have dipped their hands to fund it. But if there is a fund, the hospital will not pay anything, the hospital will not arrange it. They will just send the phone to the hospital and do all necessary arrangements so that they can do it. Because what they are doing is sustainability. it's better. So to keep things going, they need funds.
Yeah.
So what will be your advice to the general public towards that?
What I would advise the general public with regards to Right to See their program, it's a very good program, and anything you see, sustainability is key. You understand? Since these people, they are coming out to help people to screen their eyes and give free treatment, which is coming out from their own pocket. I think it will be very important as us Gambians and clinics, if we can help them in doing that, in sustaining this program they have started, it will be something that is very, very, very important. So, as these people they are here, they have started with JESHWANG. They can go to, and they say that they will be going to Ibota. So, us the clinics, we can help them. You understand? Because if you can see our list, we registered more than 200 people. So, maybe Ibota we also have more than 200 people. So, it is us, it is our right to help them or to work with them in making sure that this thing it's sustained. You understand? It's going on, because we can start here, run the clinics around the world, around the country in the Gambia, and it will be something that will maintain. We can do annually, maybe every 3 months. We go back to the hospitals we have visited, but they cannot do it if they don't have funds. So we are urging all the NGOs to help us, to help this program to sustain it, to make sure that it's something that it's something that will benefit the Gambians. So we need to make sure that they have funds, and we try. If you know any clinic that wants to work with them, they can give them a call, they can reach out to them, because they are here. If they reach out to them, they will come with their things. All you need to do is to just facilitate the logistics, and they are here. So we are very glad to have them here. Yeah.
Finally, what will be your remarks?
Yes, what I would say that as the finance person, as the accountant of all this one, we are happy to have them here. And looking at what they are doing, we are very, very, very grateful, because they come with all the necessary things they need when it comes to eye screening and eye treatment. They have glasses, they have all of it, which makes us very, very, very happy. So I don't have anything else to say but to thank you and the media and the team of JESHWANG for having this program and seeing it that it will be a successful event. Yes.
Okay, thank you.
Thank you so much.
Nice to meet you.
Nice to meet you too. Thank you.
Bye-bye.
Bye-bye.